So as I was saying, I would like to share this European perspective on healthcare sustainability and planetary health. We haven't mentioned maybe planetary health enough today, but I will try to also share a very practical perspective from our experience here in the Planetary Health Development Center. Actually, the key idea of this presentation is quite simple, that, and Alba and David mentioned it before, health systems are not only affected by climate change, they are also contributors to the problem, and therefore, we must become part of this solution. But how, whom, when? So these are where the problems lie. So as you know, traditionally, healthcare has focused on treating disease, but today we understand that many of these major health risks are environmental. For example, tobacco causes around 7 million deaths every year globally, and pollution causes 9 million premature deaths. So environmental degradation is already a major public health crisis, even though my colleagues, doctors, nurses, they talk about tobacco, but they don't talk about air pollution, for example. So, and we have to change this conversation. Sustainability is no longer only an environmental issue. It had become a health system transformation issue. So, well, you can see here how pollution already exceeds many of the traditional health risks. And this is important because healthcare systems are designed to react to disease, but not always to address upstream environmental determinants like these ones. So, and here comes the planetary boundaries that I'm sure you have already seen, this framework that defines this safe operating space for humanity. And the important message here is that human health depends on a stable health systems. As I'm an environmental scientist, we have been taught about it a lot, but today, several boundaries are already transgressed. Actually, this is the framework of 2025, last publication, based for integrity, nitrogen and phosphorus cycles, novel entities. So, and this creates what many authors call an ecological paradox. No, human health indicators improve during the same decades in which we destabilize the planet. So, and this started, actually, I don't know if you were aware of that, but this framework of the planetary health boundaries were first published in 2009. And in 2009, we crossed, actually 4 boundaries were crossed, and nowadays it's seven out of 9. And this is the official definition of planetary health. It comes from the Rockefeller Foundation and the Lancet in 2015. And this is why, when we're talking about this ecological paradox, the concept of planetary health emerged. The key idea actually is that health gains should not come at the expense of the Earth systems that sustain life, precisely because Earth systems sustain our own lives. So in simple words, human health and the health of the planet must go together. And talking about healthcare transitions, I always like to explain that sometimes we only talk about climate change, but in reality, this is an everything change. Food systems, biodiversity loss, pollution, water resource extraction, mobility, urban design, as Alba was mentioning before, all these systems interact. So we have to somehow change our perspective. And I think I like to refer to this publication that it was from last summer 2025, that work, this publication is connecting these planetary boundaries to different dimensions of human health. So as we were talking before, this Earth system changes directly affect all dimensions of health. They affect non-communicable diseases, infectious diseases, mental health, nutrition, maternal and child health, and importantly, health impacts may appear before those planetary boundaries are fully crossed. So I truly recommend this publication here from Sam Myers, that actually is the director of the Planetary Health Alliance in Johns Hopkins University, because there is a fantastic table of more than 300 lines connecting all these planetary boundaries to different dimensions of health. And this is where the concept of co-benefits becomes extremely important. I don't know if you're aware of this table of 2x2 table that talks about the co-benefits and trade-offs. This is I think it's a fantastic idea of Dr. Jose Maria Anton. And this is a way of explaining why human health and planet health should go together. So as you have been talking before, in the top right square, we have the antibiotics and health systems, which is good for us, but is not good for the planet. Smoking, as you can see, is bad for us and is bad for the planet. And maybe if we focus on the green, what is good for the planet and good for us, there we can find co-benefits, sustainable cities, sustainable food systems. So many climate solutions are also health solutions. A typical example, traditional example is active mobility reduces emissions, but also obesity, diabetes, and cardiovascular diseases. So, and healthy sustainable diets reduce emissions and at the same time improves the health outcomes. So this is critical to talk about it because planetary health is not about sacrifice. It is about redesigning systems to create multiple benefits simultaneously. We have been talking about it a lot, this 5% of global greenhouse gases emissions that are accounted to the health sector. As you know, this data comes from the Healthcare Without Harm report from 2019. And I'm sure that you have seen lots of this carbon footprint of national health systems. This is the one from UK. This is the one from Canada and the Chinese. And I would say that with all these carbon footprint calculations, maybe the key message is that most emissions do not come from hospitals, buildings. They come from scope 3 emissions, pharmaceuticals, medical devices, supply chains, food transfer, procurement. So I'm glad to see that AstraZeneca is here to be involved in this challenge. So actually, this changes the scale of the challenge. Actually, decarbonization is not only an engineering problem, but it has become a governance and procurement problem. So as at ISGlobal, we co-chair the Lancet Countdown report in Europe. And so responding to this need, I'm sure you're aware of this report, the Lancet Countdown was created. Actually, it publishes an annual indicator report since 2015. And let me share with you, this has been published this last week. Let me focus on Europe. So as you can see here, we have a lovely indicator in the Lancet Countdown report of health and climate change in Europe. I do like this, actually this indicator, because it shows easily how the national health systems respond to the climate crisis. So as you can see here, healthcare emissions per capita have decreased slightly, but actually absolute emissions remain almost stable. So the pace is still insufficient for a net zero trajectory. And we have to say that. And another important insight, and that's why I was saying that this figure here is really cool. Countries can achieve very good health outcomes with lower emissions. So we have to understand that high quality healthcare does not necessarily require high carbon healthcare. You can see here that we are here in Spain, up on the top left quadrant of the viewer. But I also want to mention that one risk is what we call this carbon tunnel vision. Climate is essential, of course, but healthcare sustainability, unfortunately, is broader than carbon. We also need to consider pollution, water, materials, biodiversity, waste, toxicity, equity, whatever. Usually when I talk about it with my colleagues here in the hospital, I explain them that it's fantastic that we count the carbon emissions, and we have to do it, of course, but this is like, it's a symptom. It's like measuring the blood pressure in a body, which is, it gives you lots of information. It's a symptom that something is good or not good. It's not going fantastic, but it's only one of the indicators. So we have to take into account other determinants of our activity. And this is why I want to share with you this data study. I think is very interesting because it expands the analysis beyond climate. And again, here you can see that pharmaceuticals appear as one of the largest contributors across multiple environmental impacts. I also wanted to share with you, moving to Catalonia a little bit, even though David has already explained a little bit the situation here, but we were participating to this European Catalyze project. We had the opportunity to analyze the footprint of the Catalan healthcare system, which I think there are some cool things to share today to give you some food for thought for the later on work. As you can see here, the sector generated around 1.3 million tons of CO2 equivalent in 2023, and as in the other countries or the regions, more than 80% comes from the Scope 3 emissions. But if we have maybe a focus on what will happen, this report identifies there is a critical driver, and this is the aging population that we have. So nowadays, it's like a population of more than 65 years is 19% of the Catalan population, but on 2050, it will become almost 30%, almost 1/3 of our population, and means that it could add more than 144 kilotons of CO2 equivalent by 2050 if we don't change our care models. So we need to not only a cross-sector transformation that we have been talking before, but also to reduce the demand. So we have to focus on prevention and new care models. Prevention is also a sustainability strategy for our healthcare sector. And next to that, an also interesting thing I would say with this study is that this study identifies that 70% of mitigation measures the technicians already considered feasible. So the barriers are not mainly technical. The barriers usually are budget, coordination, governance, and social acceptance. So this is something that I think I find it very important, that the highest impact actions are system level: procurement, mobility, energy, telemedicine, electrification. So another idea that I want to share with you is that this means that decarbonization cannot rely only on motivated professionals. We have lots of motivated professionals working for sustainability, but they are doing isolated bottom-up projects. And if we want to achieve this transition, we need to change this perspective. So going back to the European perspective, a little bit of what the WHO proposes as an integrated framework. The integrated approach is based, as you can see, on mitigation and adaptation, because health systems must both reduce their own footprint and prepare for climate impacts. And as you can see also, the WHO focuses on health co-benefits, and with this systems approach and embedding climate considerations into health system planning, governance, and financing. And I would remark that this has to do with the idea that this is also from the WHO, that they have this idea that the health risk has to do with susceptibility, how vulnerable is your health to those impacts, the hazard, what is the likelihood of happening of these climate-related events, and the exposure. So with these three elements, is the formula to calculate the health risk. And because we are kind of aware of the health outcomes and how the health systems must become more resilient to these health outcomes, but it's the same health systems that are already causing part of this climate change. And I wanted also to share with you this indicator that was published 2 weeks ago, but talking about adaptation. No? So this is not something that should be theoretical. In Europe, we are already seeing increased heat-related mortality, especially in vulnerable populations. And here in the Mediterranean, we are one of the most affected by this situation. So the World Health Organization has created this operational framework for building these climate resilient and low carbon health systems. So I think it's cool that it treats sustainability as a health system issue, and they focus on leadership, workforce, financing, technology, services, governance, so that everything must evolve together. And as Alba was mentioning before, they have created this initiative, this WHO-led global initiative, ATTACH, the Alliance for Transformative Action on Climate and Health, that brings together governments and partners to accelerate the transition towards this low carbon and climate resilient healthcare. It's helping countries move from commitments to implementation. And like Healthcare Without Harm, I think it has probably become the most influential implementation network globally nowadays. But next to that, the WHO has also in Europe actually has created this regional strategy to integrate climate change into health systems and policies that is called the Pan-European Strategy on Climate Change and Health. We have had the opportunity to be invited by them to in some discussions. And actually they position health systems as both responders and actors of change, and they are trying to link the climate policy with public health mostly. So I think it's another actor that we should follow up. And the second actor next to the WHO in Europe is Healthcare Without Harm. I'm sure that you are well aware of them. It's a global nonprofit network working to transform healthcare worldwide into low carbon sustainable. This number of the 5% that we are using everywhere, it comes from its report from 2019, when they were already shouting to these 4 principles that health sector must take responsibility, must adapt, and must mitigate. And the most important thing, they have to lead the way toward decarbonization. And what they were, I would say, probably the most important idea, or for me, the most important idea here is that they were sharing with this global roadmap. Is that the challenge? It's a challenge of ambition. So we have to rise the level of decarbonization versus these bottom-up initiatives, which are fantastic, led by volunteers. But if we don't strategize the progress in line with a strategy, actually, it won't make any change. So let me share with you the strategy that they have presented. They have published it very recently. So I would say that, to remark that one of the most important insights from the Healthcare Without Harm roadmap has to do that, they say that the transition requires system transformation at multiple levels simultaneously. So it's not only energy, but also food, travel, building, circularity, procurement, and pharmaceuticals. And another cool thing is that they were saying that the ambition that they have for 2030 is that, I quote that, is not nothing translated, is written like this. They want that healthcare should become a key driver of planetary health. So I think this is something to take into account. And let me share with you maybe the third actor in Europe, most important actor in Europe to frame the healthcare transition is the Planetary Health Alliance. They are, I don't know if you were aware of them. They are based in the Johns Hopkins University. I would say that it's the world's leading planetary health network, bringing together more than 500 universities. And I think that this is where planetary health adds value. Planetary health is broader than sustainability healthcare, but it connects healthcare transformation with food systems, biodiversity, urban systems, equity, and this societal transformation. So let me share with you that since it's last January here in the Planetary Health Development Center, we are leading through ISGlobal and a cluster of Catalan institutions, the European Planetary Health Roadmap for a Planetary Health Alliance. Last thing to mention is that this paper that I wanted to share with you too, that I think it's a paper that highlights something very important in Catalonia, at least, and everywhere, I would say, that decarbonization is not only technical, it requires this behavioral, organizational, financial, and political transformation. So this approach of theory of change, I think it was really well explained here by a friend of ours, Olena. That with these core change pathways, we need to, how to say that? These are the pathways, the policy, industry, healthcare, and workers are the core change pathways, but they need some enablers. So they need to be supported by governance, finance, digitalization, and knowledge systems in order to evolve from and change from the motivation to something more that reaches implementation and monitoring and evaluation. So I don't want to spend more time here. I'll explain it perfectly and also David. So let me also share what we are doing here in a very in the last few minutes that I have. I think another thing we can talk about later on is how we rethink the role of hospitals. So how can not understand hospitals like places that we treat diseases, but how hospitals can also reshape or help reshape how societies live, consume, move, and reconnect with the planet. So how the role of hospitals can go beyond the boundaries of clinical care. And this is something that, let me share with you, has been done here at Fundació Sanitària Mollet. This is lots of awards that my colleagues have received during the last 15 years. Is a long-term strategy that has allowed the hospital to become net zero in scope 1 and scope 2. And honestly, I think the most important result is not the emission reduction. It is, of course, it's an enormous challenge, but it is the organizational culture. Sustainability has become embedded into governance and professional engagement here, and this is what leads to these results here in the Mollet University Hospital. And it's not only about CO2, as I was saying, it also has to do with biological waste, it has to do with water, it has to do also with the amount of virtual patient appointments that we have done. And of course, it has to do with this culture focused on sustainability. We have one environmental ambassador representing every important process here in the hospital. And so this is why, building on this excellence on environmental sustainability leadership at Fundació Sanitària Mollet and in synergy with ISGlobal mission to translate planetary health research, this is why 1 year ago this Planetary Health Development Center started, and we have created it as a living lab that catalyzes planetary health solutions. So we combine the scientific evidence from ISGlobal with real healthcare implementation from FSM, Fundació Sanitària Mollet. So our idea was, how do we move from isolated hospital sustainability projects towards this systemic planetary health transformation? And we are doing this with, we collaborate with several master's programs. Here you can see, we can also have this agreement with Geneva Sustainability Center, which is the sustainability center from the International Hospital Federation. We became a hub, a certified learning hub for them. And next to that, we have this lovely space where we train lots of professionals here in Catalonia. But maybe one of the most interesting things, lines of work for you, is a territorial planetary health, because we understand that hospitals alone cannot solve the challenges, that health depends on mobility, on housing, on food systems. And this is why we created this planetary health roundtable with different actors here in the territory. Mostly they are health technicians from city councils and pharmaceuticals and primary care. And what we will do, we are focused on co-benefits. You know that co-benefits are the positive effects on human health that derive from policies or actions aimed at another main object, for example, climate change, but they include this logic of co-benefits to strengthen the argument of investments in health. So from this figure here, you can identify that the main health benefits are obtained through the reduction of air pollution, the consumption, the healthy and sustainable diets, and the promotion of active travel and public transport. This is something that we have been studying a lot at ISGlobal, and this is one of the most well-known examples, but here you have some numbers. As I was saying, food systems are probably one of the clearest examples of planetary health. They are major drivers of emissions and planetary boundary translations too, but they are also directly connected to chronic disease. So in a situation of that we have limited resources, limited time, and an emergency situation, we should, I would say that we should focus on those initiatives that provide the maximum climate benefit and at the same time the biggest health benefit for human. So what we do also, as I was saying, I have already mentioned that. So I would say that maybe today there is a growing international alignment with WHO, attached, Healthcare with FSM, the Planetary Health Alliance, different European initiatives, different regional strategies. But here also you can see some projects that we are working with, the GREAT approach. Also, we have a university master's degree in planetary health at work, and we also work with another planetary health center in a Canadian hospital. But I think the challenge here is that the implementation remains fragmented. So last message that I wanted to share with you is, where do I think that the system still struggle? Let me summarize it in 4 gaps. I think it has to do with governance. Who is responsible? Where is the ownership? The accountability remains unclear. Is weakly integrated across policy levels. Still scaling again. No, second point is scaling. How can we move from pilots to system change? We have a predominance of bottom-up initiatives in Spain, in Catalonia, but we don't have a scaling mechanism. What needs to change to move from this initiative to this system transformation? This is the question from my point of view. Not only the financing, but the incentives, they are misaligned. There is a lack of dedicated funding and incentives for decarbonization, especially scope 3. And finally, I would say the measurement gap. We don't have standardized metrics. Of course, we have these emissions and calculators of CO2 equivalent emissions, but how are we calculating the co-benefits, and how we calculate not the carbon footprint, but the environmental footprint? And how we calculate, I would suggest that we need at least 3 indicators: environmental footprint, health co-benefits, and the system resilience. These are 3 indicators, I would say, the preparedness of climate risk that healthcare is not already accounting. No? So we need these standardized indicators and mechanisms to move from pilots to those system transformation. So my final message is this: healthcare systems cannot remain only providers of care, as we are. I think we do all agree. We must become actors of this societal transformation, and mostly because protecting human health increasingly means protecting the conditions that make our health possible. So thank you very much for your attention.